So back in the mid-1960s, President Lyndon B. Johnson launched his famous Great Society agenda. It was a full-on, unconditional war on poverty. And right at the heart of that war were two healthcare programs you've definitely heard of, Medicare and Medicaid. Today, we're going to dig into their incredibly complex legacy.
Okay, let's get right into it because here's the central puzzle. For more than half a century, these programs have been called one of the greatest things America has ever done, socially. But at the exact same time, a lot of analysts, including the historian Paul Starr, say they represent one of our biggest failures.
So that's the big question, right? How can both of those things be true? How can a policy that lifted millions out of misery also be seen as the root of some of our deepest, most lasting problems? Well, that's exactly what we're going to unpack.
And our guide for this journey is really the foundational work by Paul Starr. His analysis is what helps us frame this whole fascinating story of triumph and, tragedy. It helps us see way beyond the simple headlines.
First things first, we need to set the stage. To really get the massive impact of what happened in 1965, you have to understand what America looked like before these programs existed. And honestly, it was a system defined mostly by what wasn't there.
You know, national health insurance wasn't some new, radical idea in the 60s. Not at all. In fact, for about 50 years, it was the great unfinished business of American social policy. Progressives tried and failed. FDR's team had to leave it out of Social Security just to get that passed. And then Harry Truman, he called for it, and he got completely shut down. The idea just could not get through Congress.
And that right there, that gets to the real human cost. See, the system we were building was based on getting insurance through your job. That's great if you have a good, steady job. But it left the most vulnerable people totally exposed. If you were old or if you were poor, one bad illness could spell complete financial ruin. There was just no safety net.
So, what changed? What finally broke this decades-long deadlock? Well, it took nothing short of a political masterstroke, pulled off by one of the most legislatively powerful presidents in American history.
LBJ was just a force of nature. He was absolutely relentless. He went after the single biggest roadblock, the super powerful chairman of the House Ways and Means Committee, a guy named Wilbur Mills. And in phone calls that we actually have on tape, Johnson just works on him. He flatters him, he pressures him, he promises him a place in the history books.
Now, this is where it gets really clever. After the 1964 election, Mills is facing this huge wave of Democrats in Congress. But he doesn't just cave. No, he does something brilliant. He basically takes the Democrats' main plan, which was hospital insurance for seniors. Then he adds the Republicans' alternative plan to cover doctors' bills. And then he throws in a plan for the poor that the powerful American Medical Association wanted.
And boom, just like that, this three-layered cake, as they called it, became the blueprint for the whole thing. It was a stroke of political genius, really. It gave every major player a piece of the pie and created the exact structure we have today: Medicare Part A, Medicare Part B, and Medicaid.
And wow, were the results immediate. They were absolutely profound. I mean, on this one front, you could really say the war on poverty was an incredible success. The impact was just massive.
And you have to understand, the only reason they could pull off something this huge was because of the political moment. Johnson had this overwhelmingly liberal Congress, the 89th Congress, and he got his way in almost unheard of 96% of the time. That gave him the political muscle to push through these massive poverty-fighting programs.
And just look at this. The numbers are staggering. In just 7 years, from when Johnson first took office to when these programs really took hold, the percentage of Americans living in poverty just plummeted. It went from over 22% down to just over 12%.
And this wasn't just some abstract number on a chart. We're talking about real, tangible, life-changing improvements for millions of people. For the very first time, the elderly and the poor had actual access to medical care. Infant mortality among the poor dropped by a third. The number of poor people who had never even seen a doctor was cut by more than half. It was a huge deal.
But, and there's always a but, isn't there? This is where the story takes a turn. Because all those political compromises they made back in 1965, well, they baked some serious structural problems into the system. And in many ways, the bill for those decisions has come due.
So the biggest issue was the creation of what's now called a two-tier system. See, instead of creating one single universal program for everyone, the Great Society built two totally separate parallel ones, one for the elderly and another, often worse, system for the poor.
And this table just lays out the divide perfectly. You've got Medicare, a single federal program. It's funded through social insurance, so it's seen as an earned right, like Social Security. Then you've got Medicaid. It's run by the states, funded as public assistance, and pretty much from day one, it was stigmatized as welfare. Totally different worlds.
Okay, and here's the other really critical flaw. To get the powerful doctors and hospitals on board, the ones who had fought national health care for decades, Johnson's team made this huge concession. They promised that Medicare would basically pay hospitals whatever they charged. And that single decision unleashed decades of runaway healthcare inflation. That problem started the moment the law was signed.
So all of this, it brings us right up to today, to this uncertain, contested future. It's an unfinished debate that really started all the way back in 1965.
And here is the great irony of the whole thing. The original architects, they hoped Medicare would just be the first step, the foundation for a truly universal system. But instead, by creating this really popular, powerful program just for seniors, it created a massive political group that has time and again resisted expanding the system to everyone else. It actually made future reforms much, much harder.
Which brings us back full circle. This quote from Paul Starr just nails the paradox we've been talking about. The very things that made the Great Society programs a success, the political compromises, the targeting of specific groups, also created some of the system's most profound and lasting failures.
So it kind of leaves us with this big, challenging question to chew on. When we try to make these huge, historic changes, is it basically inevitable that the solutions we create today just end up becoming the complex problems of tomorrow?